All right, so why this topic, side effects on medication then? All right, very simple, right? The incidence of drug side effects is on the rise, right? That goes throughout the whole world there, especially in the developed countries, right? Like in Singapore, like in US, all right? Millions of people are affected by side effects of medication every year, all right? This is especially so when there is a huge increase of drugs used for chronic problems, diabetes, high cholesterol, high blood pressure, so on and so forth. And we also know for a fact that the longer you use medication, the higher the risk of side effects there, right? All the reported figures that you see on the medical websites, medical authority websites and all that are just the tip of the iceberg there, all right? There are many instances which are not reported at all, right? They could be minor, they could be potentially a bit more serious, but they are often not reported because it can be a real hassle, I guess, for the doctors to report every single side effect. So as such, what you see, the figures are just the tip of the iceberg. And the second reason why I want to do this topic is because people are now over-reliant on medication to fix their medical problem. They think that medication is a silver bullet for everything. All right, hey, you got this illness A, oh, you take this drug A, you'll fix your problem. You got this illness B, you take drug B, fix your problem, right? No, unfortunately, that's not the case there, all right? Because very often, we are not fixing the root causes. And it's a known fact that all drugs, whether it's over-the-counter or prescribed, can have side effects, right? So more people are now on medication than before, as mentioned, okay? Especially for chronic illnesses there, okay? And I want you to be aware that there are possible safer and more sensible alternatives to drugs, especially for lifestyle-related illnesses, all right? Always tell people, look, you've got a lifestyle-related illnesses like type 2 diabetes, you just can't be popping pills to fix your problem, thinking that, oh, by taking pills, my diabetes is controlled and that's it, I don't have to do anything else. Wrong, all right? You cannot fix a lifestyle-related illness by simply popping a pill, not at all there, all right? You need to have a holistic approach there. You need to have lifestyle changes, dietary changes there, all right? You may want to take nutritional supplements, etc., to help you. So I'm sure every one of you will be asking yourselves, why do side effects occur? And all of you, I myself included in the past, assume that, well, drugs are designed to target specific medical problems, right? Well, guess what? They rarely do, right? All right, this is because of the following reasons. Drugs can have effects on multiple organs. Very simple, all right? We'll talk about that in a while, right? The drugs that you take can interfere with other natural processes of our body, the various enzyme systems there, all right? It can affect one organ and another organ as well. For example, the statins, which are supposed to reduce cholesterol production in the liver, can also affect your coenzyme Q10 production, all right? With its severe side effects as well, which I will talk about. Thirdly, there are also interactions with other medication there, all right? The various drugs have got a tendency to interact with other drugs, all right? Free radicals are produced during drug metabolism. This increases the oxidative stress in your body, all right? And then there's also harmful metabolites, which are produced during drug metabolism. For example, the paracetamol or the Panadol, the brand name Panadol, every one of you are familiar with, right? Produces a metabolite called NAPQI. And this particular metabolite is extremely toxic to the liver cells, and it can reduce glutathione level, all right? So do not overuse paracetamol there, okay? So let's talk about some of the common side effects there, all right? Well, allergy reactions, okay? Are pretty common there. You'll hear from time to time, so-and-so is allergic to this painkiller or that or whatever, all right? And then the allergy reactions can be mild to severe there. In its mildest form, you can have a bit of a, angioedema, which causes eyelid swelling, lip swelling, all right? Or it can cause some localized rashes or even generalized rashes. In a more severe form, it can cause what we call a severe cutaneous adverse reaction, like Stevens-Johnson syndrome, all right, or worst case scenario, a life-threatening anaphylactic reaction there, all right? Then, of course, there's the usual gastrointestinal side effects like nausea, vomiting, bloatedness, discomfort, diarrhea. The reason why many drugs are associated with gastrointestinal side effects because the drugs very often may have a direct irritating effect on the GI tract there, all right? So these are the common side effects that many drugs tend to have there, okay? Let's talk about something that seems to be benign there, all right? The oral nasal decongestant. I'm sure every one of you have taken at one time or another there, all right? You are used to dry up your nose or sinuses, being a drippy nose. Well, okay, you can take things like pseudoephedrine or phenylephrine there, all right? Okay. Well, guess what? These drugs are not without side effects. These are available readily over the counter now. Okay, that means you don't require prescription. So all the more you got to be careful there. All right. So one of the common side effects that you can have cardiovascular side effects. Okay, these kind of medication can increase your blood pressure and increase your heart rate, and in some cases cause abnormal heart rhythm as well. So if you have got high blood pressure already or abnormal heart rhythm, you should be particularly careful with this there. All right. It can cause neurological side effects like dizziness, anxiety, confusion. If you make you feel restless, even cause tremor and even insomnia. Some people there, all right? So if you take this particular drug, in the late afternoon or at night, you may not be able to sleep at all there, all right? And then there's also neurological side effects. Male, especially, got to take note of this, that the elderly male there, right? This is very often the case because elderly male tend to have enlarged prostate. So this can cause difficulty urination for this group of people there, all right? And in worst case scenario, it can cause urine retention. You cannot even pee at all there. And this can become a medical emergency there, all right? Where you need urgent catheterization there. So be very careful, this kind of over-the-counter drugs there. All right, then let's talk about something which I'm sure many of you are on, or you know people who are on there, all right? Statins, right? Statins are a class of drugs which we use to lower cholesterol, all right? Cholesterol is the hot topic now in this current few decades, is it not, all right? I'm sure you will know, even if you yourself are not on statin, I'm sure you know someone who's on statin, all right? Okay, examples would be like atorvastatin or the famous Lipitor, or rosuvastatin like Crestor, or the older generation drugs like simvastatin there, all right? So it seems like half the world is on this statin there, all right? And it's been, to me, overprescribed there, all right? Okay, all right, so what are the side effects then, okay? Firstly, it can affect the muscle. Statins are well known to cause muscle inflammation. All right, it can cause a muscle to ache. It can cause pain even in the muscles there. It can cause it to be tender to touch. It can even cause the muscles to be weak, all right, causing generalized weakness. And this problem can be worsened when you exercise there. In the worst case scenario, all right, the inflammation can be so bad that it causes the muscle protein to break down, causing a condition what we call rhabdomyolysis there. And when the muscle protein breaks down, it can cause kidney failure, all right? And unfortunately, this has happened quite more than a few times in the past there, all right? Right? And kidney failure, as you know, is not a nice thing to have. Yeah? All right, the next side effect is that it can cause inflammation of the liver. That's right. I'm sure some of you who have taken statins before will have noticed your liver enzymes have gone up. This is because of the statin side effect causing liver inflammation there. In some cases, the liver inflammation can be so bad, that the liver enzymes run into hundreds, the value, the AST, ALT, etc., goes up way high into even thousands as well. I've seen for myself there, all right? Now, what can happen? Well, when you get a very bad liver inflammation or chronic low-grade inflammation, it can cause scarring of the liver, resulting in cirrhosis there. All right. So those of you who are taking statins, do take note. Get your liver function checked regularly there. All right. Don't simply dismiss, oh, just mildly elevated, it's okay, Well, this kind of chronic inflammation of the liver can lead to more serious conditions down the road there. All right. Now, it can also affect the brain. It's well known now that statins can result in decline in cognitive function and memory loss as well, right? In the elderly, this can cause confusion there. Now, this decline in cognitive function is very often, unfortunately, attributed to aging. Oh, you're getting old, that's all. Don't worry, this happens all the time when you get old. Well, I got news for you, folks. Statins definitely increase the risk of decline in cognitive function, all right? Worsen your memory loss there, all right? So don't just take it as natural or due to aging, my age. No, I wouldn't buy that there, okay? Now, statins can increase your blood sugar level and increase the risk of diabetes, right? The longer you take the statin drug, the risk of dysglycemia or abnormal blood sugar level and the risk of diabetes increase. In fact, studies have shown that you take the statins for 2 years or more, the risk of dysglycemia and diabetes goes up a lot there, all right? So be very careful if you are already diabetic, okay? Now, statins can also affect the heart. It can weaken your heart muscle, causing what we call cardiomyopathy, all right? When you get cardiomyopathy, your heart function will weaken there. Right? It can cause heart failure. And I see this as ironical. In the first place, statins is supposed to help to improve reduce risk of coronary heart disease, and yet it can cause cardiomyopathy, weakening your heart muscle. This is very, very ironical there, okay? So be very careful there, people with heart conditions. So what do statins do really? Right? Yes, it reduces the cholesterol production in the liver by inhibiting an enzyme called HMG-CoA reductase. But unfortunately, when the statins inhibit this particular enzyme, you also inhibit the coenzyme Q10 production. Right? This is because the coenzyme Q10 production shares a common pathway with the production of cholesterol because they use the same enzyme, the HMG-CoA reductase. So when the statins inhibit this particular enzyme, you inhibit not only cholesterol production, you also inhibit the production of coenzyme Q10. So what's coenzyme Q10, you may be asking, all right? Well, guess what? Coenzyme Q10 is extremely important for energy production in the cell, in the mitochondria, all right? Is this energy which powers the cell, which enables the cell to function normally. If your cells don't have this energy, well, guess what? The function of your tissue and organ will be affected, right? Second function of coenzyme Q10 is that it's also an antioxidant for the cell. It mops up the free radicals, preventing or reducing the damage from these free radicals. So if your cell lacks coenzyme Q10, all right, what's going to happen is that, all right, the free radicals can cause a lot of damage to the cells, all right? And on top of that, your cell's it's not going to produce enough energy to function normally there, all right? And further bad news for you is this: your level of coenzyme Q10 will decline as you age as well. So when you take statins, you further decline the coenzyme Q10 in your body. This is really, really bad for you there, all right? So you've got to be really careful. Those of you who are taking statins, who are constrained to take statins, all right? You must bear all these factors in mind. And, well, further news is this: statins don't reduce the triglycerides at all. All you know that triglycerides is the bad fat, all right? The higher it is, the better it is for our body. Well, statins don't. reduce triglycerides. So if you have got high triglyceride level, you might want to consider other alternatives like omega-3 fish oil, the astaxanthin there, all right? Because these can help to reduce triglycerides there. Now, those of you who want to take statins, well, you might want to, or don't want to take statins, rather, sorry, you might want to consider other alternatives there, all right? You can consider plant sterols, red yeast rice, niacin, all right? You can consider probiotics. Yes, probiotics does help, but not very significantly, but it helps. Okay, it's got other health benefits as well. Or we can consider a product called lipid trim there, which I will talk briefly, all right? So in view of all these side effects there, all right, you got to use statins judiciously there, all right? If you have got to use statins, please take the coenzyme Q10 supplements there, all right? This to me is non-negotiable, all right? So the very reasons I just explained there. All right, so I mentioned fish oil just now. So for those of you who have got high triglyceride level, you can consider omega-3 fish oil there, okay? So what can omega-3 fish oil do for you there really, okay? Well, it can help to maintain normal levels of cholesterol, all right? It can help to increase your good cholesterol, HDL, all right? It can potentially reduce your LDL as well, okay? Not as much as statins though, all right? Okay. Right? But it does help to some extent there. And it can also help to maintain a healthy blood pressure, right? Helps to maintain normal blood flow because, all right, it reduces the risk of abnormal blood clotting, all right? Prevent the blood from being sluggish there, all right? As I mentioned earlier, it helps to reduce triglyceride level, right? It helps to improve overall cardiovascular health there. Numerous studies in the past have shown this there, all right? And on top of that, other benefits to boot, it helps the complexion, it helps your mood as well there too, all right? Okay, so when you choose a fish oil, the number of factors which I want you to consider. Firstly, is the source of oil from big fish or small fish there? Ideally, we want it to be from small fish like sardines and anchovies there, all right? This is because, all right, these small fishes have got a short life cycle, short lifespan, really, all right? Therefore, they don't accumulate that much toxins and heavy metals from the environment, unlike a big fish, all right? Now, for this particular oil product that I mentioned, all right, they are sourced from the small fish, the sardines and the anchovies. And these small fishes are harvested off the coast of Peru, which the waters of which are relatively unpolluted there, okay? And then the next thing you want to consider is, does the fish oil that you take meet or exceed standards set by authorities there, all right? And for this particular oil, I can tell you it meets and even exceeds the standard set by the Canadian, the European, and even the US authorities as well, okay? Now, next consideration is this, right? Is your fish oil that you're taking more likely distilled, right, and independently tested after that by another company? Well, guess what? This particular product is there, all right? It is more likely distilled to remove any possible remnant toxins and heavy metals there, all right? It has got to pass through, what, more than 200 quality checks during the production process, all right? This oil is not tested once, but twice, once by the manufacturer and then by another independent testing company for what? For mercury, lead, PCB, and other heavy metals there, okay? And then this oil has got vitamin E, natural vitamin E added. Why? To prevent oxidation of oil. That's right, ladies and gentlemen. Fish oil can become oxidized. And when they are oxidized, they become rancid. They are toxic to our body. All right, that is why some of the fish oil products out there has got a very strong fishy smell the moment you open the bottle. I can tell you this, they are very likely to be oxidized already. Well, for this particular heart health omega-3 fish oil, right, you have got a natural vitamin E added to prevent oxidation there, all right? So that is why this product does not have that strong fishy odor at all, right? The next factor you want to consider is the amount of EPA and DHA. These are the two most essential omega-3 fatty acids that we want, all right? Okay, the EPA and DHA. All right, and I can tell you for this particular, each serving of 2 pills, all right, gives you 3,000 mg, all right, of omega-3 fish oil. And of this, right, 900 is EPA and 600 milligram of this is DHA there. All right, that is very, very high. So in other words, each pill has got 1,500 of omega-3 fish oil and 750 mil, out of which 750 milligram is EPA and DHA. All right, that's very high. In fact, it's one of the highest in the market. There are a few others in the market as well. But okay. Right. So, and the good thing about this particular EPA and DHA is that they have got a ratio of 1.5 to 1, which is ideal to reduce inflammation there. Studies have shown that this is the ideal ratio to reduce inflammation in our body. All right. So choose wisely. All right. Do consider all these factors if you will have to choose the omega-3 fish oil there. Now, I mentioned lipid trim just now there. Lipid trim, this particular product, okay, Heart Health Lipid Trim, can help to reduce cholesterol, among other benefits there, okay? It can help to promote healthy cholesterol production, healthy levels of total cholesterol, the LDL cholesterol, and triglycerides as well. It also helps to promote healthy cardiovascular function and healthy blood vessels there, provides antioxidant support for the heart. Right, so what are unique points about this particular product? Well, it contains this proprietary extract called Caprose. It basically consists of Indian gooseberry fruit there, right? This particular extract, fruit extract, is well known, has been well studied as well. It's been shown to increase the HDL, right, the lipoprotein, to transport the excess cholesterol away from the heart and back to the liver for metabolism and elimination there, right? And it prevents also the oxidation of LDL particles. That's right. Ladies and gentlemen, it's not, bear in mind that very often, all right, it's the oxidation of cholesterol that's much more important to me, all right, than just a pure number of the LDL there, all right? Especially the LDL particles are much more important than the LDL there, okay? These small, dense LDL particles are the major culprits in causing heart disease there, not the big fluffy LDL particles there, all right? So measuring the LDL alone is not enough there. We need to know, ideally, the small, dense LDL particles there, all right? And we also need to prevent the oxidation of the LDL there, right? In order to reduce the risk of cardiovascular disease there. Now, this particular product also contains this Citrus sinensis fruit peel there. So what does this particular fruit peel contain? Well, it contains this flavonoids there, all right, called PMFs for short there, all right? This PMF compounds help to support normal triglyceride and cholesterol levels. How does it do so? Basically, it inhibits, all right, the enzyme that's necessary for triglyceride production, all right? It also increases the metabolism of fatty acids that helps to burn the fatty acids, really, okay? That's good, all right? It also inhibits another enzyme that's required for production of these LDL particles, therefore reducing your LDL levels there, all right? So that's how, these are the benefits of this particular product there. Okay, now I talk about coenzyme Q10 just now, isn't it? Especially for those who are on statins. Okay, so what can coenzyme do for you? Well, basically it can benefit people with cardiovascular diseases there, all right? Okay, it can help to reduce the risk of repeat heart attacks. Studies have shown this. Studies have also shown it helps improve outcome in people with heart failure. And it's no wonder, because your heart is what is the organ of high metabolism, meaning that it requires a lot of coenzyme Q10. If your heart is weak in the first place, it tells me that you don't have enough one of the factors that contribute to heart failure could be because of lack of coenzyme Q10. So by increasing the coenzyme Q10 supplementation, all right, you can potentially help to improve a weak heart or heart failure. Now, coenzyme Q10 has been known to help to lower blood pressure as well. All right, and as I mentioned, help to combat the side effects of cholesterol-lowering statins. All right, so coenzyme Q10 has been shown to have cardiovascular protective effects, right? Coenzyme Q10 is abundant in organs and system that uses the most energy. So the heart is one of them, as I mentioned there, all right? Other organs would be the liver, kidneys, right? Pancreas, brain, immune system, right? So it's a powerful antioxidant, helps mop out free radicals. Okay, it also helps to increase energy level. Right. So what's so unique about this particular product I just showed you? Well, it's isotonic capable. Okay, when it's isotonic capable, right, it helps to maximize the absorption and the bioavailability of the supplement that you're taking. All right, and that's what we want. We want to get more bang for our buck, isn't it not? If you just simply take a pill, a lot of the active ingredients just simply get wash out through the other end there, all right? On the other hand, an isotonic capable product helps to maximize the bioavailability of the active ingredient where we want, okay? And each serving of this particular product, right, gives you 100 milligram of it there, right? So that's pretty high amount there, okay? Okay, let's talk about high blood pressure medication, hypertension medication there, right? I'm sure a number of you are on as well. So what does it do? It lowers blood pressure, right? Isn't it? Unfortunately, when it lowers blood pressure, right, it can potentially cause what we call postural hypotension. That means your blood pressure may drop the moment you stand upright there, right? And that has happened for a number of my patients on this medication there, right? Other potential side effects is biochemical or nutritional, right? For example, this class of drug, the ARBs, all right, angiotensin inhibitors, right, basically can increase the potassium level, all right. Diuretics can reduce water-soluble minerals like your potassium, calcium, magnesium again, and the water-soluble vitamins, vitamin Bs, and your vitamin C as well there, all right. So for those of you who are on this particular class of drugs, okay, be very careful of your electrolytes there, okay? Now, it can cause metabolic issues like increased blood sugar level. And this holds true, especially for this class of drug called beta blockers, right? Like atenolol, right? Respiratory issues like dry cough, like your ACE inhibitors, okay? Can worsen your asthma. For the beta blockers, can cause cardiovascular side effects, like reducing heart rate there. And when that happens, it can cause dizziness, even fainting as well there. Right? And this can happen when you exercise. When you exercise, your heart rate goes up for a good reason. You want to increase blood flow, isn't it? All right. But if you're taking a medication, a beta blocker, it prevents increased heart rate. And therefore, it can cause this problem of dizziness and even fainting. And calcium channel blockers can cause leg swelling or leg edema. All right. Okay, so if you want to improve your cardiovascular health, okay, besides taking medication, what other things can you take? What are supplements there? Like, so I meant omega-3 fish oil is one of them. The benefits I've talked about. Coenzyme Q10 I've just talked about, okay? Now, another thing you can take is astaxanthin, and another one is pycnogenol there, all right? So let me talk a bit about astaxanthin. Astaxanthin is basically the reddish pigment which gives marine life the color. Right? Do you know why the lobster, the prawns are red, have got a reddish hue to it? Well, it's because of the reddish pigment called astaxanthin. Astaxanthin is a powerful antioxidant there, all right? And this astaxanthin is also found in other marine life like the microalgae, all right? And this is the most abundant source of astaxanthin. Okay, astaxanthin is a powerful antioxidant. Right, it's 6,000 times more powerful than vitamin C. All right, it's a super antioxidant, in fact, astaxanthin. And then numerous studies have shown that astaxanthin has got cardiovascular benefits, helps improve muscle endurance, especially for athletes, right? And helps to protect against anti-aging as well, too. There, all right. So astaxanthin is great across the board for everybody there. All right. So what are cardiovascular benefits? Well, it can help to maintain normal cholesterol levels. Okay, it helps to actually reduce triglycerides and to increase the HDL level. All right, that's what we want there. Okay, astaxanthin can also promote a healthy blood flow to and from the heart, supports the delivery of the nutrients and oxygen to the cells, to the tissues there. All right, and it also remove the waste products away from the cells there. Okay, it helps to maintain normal blood pressure. It can protect the LDL, which is supposedly the bad cholesterol, from oxidation, right? Okay, because like I said earlier, is the oxidized LDL which are bad there, all right? Oxidized LDL a whole lot more sticky, can stick to the endothelial lining of our blood vessels, right? So astaxanthin is great for our overall health. So cardiovascular benefits, visual benefits, skin health benefits, anti-aging benefits there, right? And I take my astaxanthin from these two particular products there, okay? The prime astaxanthin or the isotonic astaxanthin there, right? The benefits are it helps support cardiovascular health, promotes healthy blood flow, right? Therefore supporting delivery of nutrients and oxygen to the tissues and organs there, and also promote the waste of removal waste products there, right? And as mentioned earlier, it's a powerful antioxidant there, all right? Imagine 6,000 times more powerful than your vitamin C. So what makes the prime astaxanthin and the isotonic astaxanthin unique? Well, it uses the astaryl astaxanthin. All right, now astaryl astaxanthin, to me, is the gold standard of all the astaxanthin in the market today there, all right? All the products that shows the benefits of astaxanthin uses astaryl astaxanthin. Now, astaryl astaxanthin is derived from algae, not from shellfish. Therefore, people who are allergic to shellfish can use astaryl astaxanthin there, all right? Now, astaryl astaxanthin is synonymous with quality and stability there, all right? Research has shown that astaryl astaxanthin rank among the purest and the most powerful antioxidants of all there, okay? And it comes in 6 milligrams serving. And this is important because all the studies which shows the benefits of using astaxanthin uses typically 6 milligram serving at the very least there, all right? At least 6 milligrams. So we want to use the correct dosage if you want to derive benefits from the supplement that we are taking there, all right? Okay, so astaxanthin is a powerful antioxidant. So this isotonic astaxanthin is vegan, gluten-free as well there. It comes in convenient packaging there, ready to go stick packs there, right? And the isotonic astaxanthin comes in isotonic delivery system, maximizing absorption and bioavailability, all right? Now, I talk about pycnogenol. Now, pycnogenol is, I'm sure some of you have heard of it. Well, yes, it's a pine bark extract, but it's not just any ordinary pine bark extract. It is the gold standard of all the pine bark extract there, all right? Okay, this particular pycnogenol is a proprietary brand of pine bark extract, and it is derived exclusively from particular southwest part of France there, all right? And the area is these trees are grown in organic environment there, right? These trees are tall, majestic there, all right? Sorry about the noise there. Okay, so pycnogenol is a powerful antioxidant as well too, all right? But studies have shown that it helps to improve blood flow, all right? It increases the endothelin-dependent vasodilation up to 32%. That's huge there. It can help to maintain blood pressure as well. It can help to reduce blood pressure by much at 5% or so there. It can help to improve the cholesterol levels as well too, reducing the LDL and improving your HDL there, okay? Now, pycnogenol has been shown to inhibit abnormal platelet aggregation there. This helps to prevent abnormal blood clots from forming there. Pycnogenol has been shown to help to improve kidney function, all right? Pycnogenol, okay, has been shown to reduce the amount of protein leakage as well. I know because I use it for one of my patients, and after several months of using a pycnogenol containing product called OPC3, all right, his protein leakage went down quite significantly there. Right, pycnogenol has been shown to reduce the progression of atherosclerosis. That's big. Right, so pycnogenol has been shown to improve the health in people with metabolic syndrome. Basically, what people with metabolic syndrome have got an increased risk of cardiovascular disease and diabetes there, all right? So if you have got this central obesity, in other words, you look prosperous, right? Okay, that's not good, all right? All right, okay, because it's one of the factor in metabolic syndrome there, all right? Well, you've got high triglyceride level, you got low HDL level, you got elevated blood pressure, all right? Or you got a high fasting blood sugar level. Well, you've got 3 out of 5 of these criteria. Well, you have got metabolic syndrome. And like I said, that's bad news. You have increased risk of diabetes and high blood pressure there, all right? But guess what? Pycnogenol has been shown in studies to improve all these parameters there. Okay. All right. So one of the products which I like very much, okay, and it contains this pycnogenol. The gold standard of all pine bark extract is this Isotonics OPC3. I take it every day myself there. All right. So OPC3 contains powerful antioxidants called OPCs. All right. Called oligomeric proanthocyanidins there. These are the class of bioflavonoid antioxidants, right? And these OPCs comes from 3 sources there, all right? From grape seed extract, from grape skin extract, and of course, not to mention the pine bark extract pycnogenol there, all right? So it contains powerful antioxidants called OPCs, all right? And your pycnogenol. So what can this Isotonics OPC3 do? Well, basically, as I said, it provides antioxidant support, helps to mop up the free radicals in your body, reducing your oxidative stress. Okay, it helps to promote cardiovascular and joint health there. It helps to maintain healthy cholesterol, blood sugar levels, helps to support blood vessel function and healthy complexion there. All right, this is a particular study done on OPC3. Okay. This particular study shows that the individuals with metabolic syndrome, which I just talked about, all right, have all the criteria of their metabolic syndrome improve after taking OPC3 over 2 months there, right? So what improved? Well, their blood pressure improved, their total cholesterol improved, the fasting sugar level also improved, and then the endothelial function improve as well. And they measure this endothelial function by checking the neck carotid arteries there, all right? Okay, the skin microcirculation also improve as well. And guess what? This plasma C-reactive protein also improves significantly, declining by more than 50%. Plasma C-reactive protein is a measure of the amount of inflammation in your body, all right? We should have this C-reactive protein as low as possible. The higher it is, the worse it is for you there, right? And OPC reduces this CRP. That's big, all right? So ladies and gentlemen, all right, don't sneeze there. This kind of products there, all right? It really, really works there, all right? And like I said, I absolutely believe in taking pycnogenol, especially the OPC3, right? OPC3 is isotonic capable. It helps to maximize the absorption and the bioavailability, all right? The absorption into your body there, all right? Okay, now the next thing I want to talk about is the side effects of diabetes medication there, all right? Unfortunately, the incidence of diabetes is on the rise in Singapore there, all right? It's going to get worse in the next 5 to 10 years there, all right? Okay, so I'm sure every one of you online will know of someone who's got diabetes, or you yourself have got diabetes, right? Okay, so let's talk about it then. So diabetic medication can potentially reduce your blood sugar level to extremely low level, all right? Yes, it's meant to lower blood sugar level. Unfortunately, it can reduce it to very, very low level, and it can be potentially life-threatening there. All right, this is especially so if you're taking insulin, all right, the sulfonylureas class of drugs, okay, basically, well, okay, now I'm talking about type 2 diabetes here now, okay, so for those type 2 diabetics out there, if you're using insulin and sulfonylureas, all right, I would be very cautious, right, because if you're taking insulin and sulfonylureas class of drug, it can promote further insulin resistance. Right? As you know, for type 2 diabetics, right, then there is the non-insulin dependent diabetics. All right, in the first place, what causes diabetes is insulin resistance. All right, if your body's producing too much insulin. But unfortunately, your body cells, tissues are not receptive to the insulin there, right? That's what causes the insulin resistance. So if you are you're using more insulin or this class of drug which cause your pancreas to secrete more insulin in your body, you will be promoting more insulin resistance. You will be aggravating your diabetes down the road. That is why for people, for diabetics who are on this class of drugs, the type 2 diabetics, again, I must emphasize, when they use this class of drugs, eventually they'll need increased dose of insulin. Eventually, they'll need increased dose of sulfonylureas, all right? And then down the road, sorry, doesn't help you anymore there, all right? So be very careful, type 2 diabetics out there, all right? Now, these class of medications can also cause gastrointestinal side effects, especially the metformin, all right? The acarbose, all right, can cause bloating, cause a lot of gas, diarrhea even, okay? Can cause nutritional side effects like, for example, metformin reduces your vitamin B12, your folate, the coenzyme Q10. These are essential nutrients that your body needs there, all right? And then can cause cardiovascular side effects like increasing the risk of heart failure. This particular class of diabetic drugs can cause this issue there. Fortunately, they are not, they're falling out of favor, right, nowadays there. Can increase cancer, again, by this class of drug, right? Can cause weight gain. Insulin causes weight gain, right? It's ironic. Yeah, that's right. So we want to, for type 2 diabetics, they should avoid insulin as much as possible, really, right? It can cause genital urinary problems there, right? Increasing the risk of infection and gangrene. And this is very specific for this class of diabetic drug called SGLT2 inhibitors there, all right? So this is because this class of drugs secretes increased excretion of sugar, glucose in your urine. And that's how it causes increased risk of infection and gangrene there, right? Now, diabetic medication for this particular class can increase the risk of fractures as well. Okay. Right, so diabetic medication is not without side effects there, okay? So what can help diabetes? Now, I'm talking about type 2 diabetics here. For type 1 diabetics, the insulin-dependent opiate, you got to use insulin because your pancreas is not secreting insulin at all there, all right? Your pancreas packed up long ago, when you were young, especially there, all right? So you got to keep using insulin. But for type 2 diabetics, the non-insulin dependent diabetics, okay, what can help diabetes? Lifestyle changes, all right? Like I said earlier, you can never treat a lifestyle-related problem like type 2 diabetes by simply popping a pill. Absolutely no way at all. What can really help you is watching what you eat. Is what you eat that's very important. You got to keep to the low glycemic index foods, the low GI foods. You should consider measures like intermittent fasting even there, all right? These measures are known to help you there, all right? Okay. And what else can help? Supplementation, like with isotonics, isochrome, curcumin, ginseng, even bitter melon, cinnamon. All these are known to help to improve, say, insulin resistance, help to lower blood sugar levels there. Okay, so this particular product, isotonics, isochrome, all right, is pretty helpful there. Okay. Well, it contains nutrients which support healthy blood sugar level and energy production. It contains chromium, which is an essential trace mineral. Now, essential trace mineral means it's a mineral which your body needs in small amount, small quantity, but it's essential because your body needs it and yet we cannot produce it. Therefore, we got to take it from our diet or through supplementation there. So chromium helps to support the metabolism of proteins, the fats, the carbs there, right? And therefore also helps to support healthy blood sugar level. Coenzyme Q10, mentioned earlier, helps in energy production. Another ingredient is L-carnitine, which helps to promote metabolism of fats and energy production. And there's also vitamins B2 and B12, which helps support energy production as well. And it comes in isotonic form, all right, promoting rapid absorption and delivery of these nutrients in your body there, all right? Now, let's talk about painkillers and anti-inflammatory drugs then, okay? So many of you have taken this one time or another. Some of you, unfortunately, are on long-term medication like this then, right? Now, we use this medication for acute and chronic painful conditions, like inflammatory joint diseases, like arthritis, all right, pain, muscle pain, headaches, even migraine in some cases there. All right. Now, the commonest use drug here would be your acetaminophen or your paracetamol, right, or Panadol, which is a well-known brand name. So I mentioned earlier, right, the metabolite can cause liver damage, NAPQ1I there, all right, can cause damage to our liver cells there. And therefore, it's highly recommended that you avoid taking more than 8 tablets of paracetamol a day there, or more than 4 grams. Okay, that's the limit there. If you take any more than 4 grams a day for adults, it can cause liver damage there. It can potentially cause liver failure, right? In fact, in the past, even right now, people who want to commit suicide take excessive amounts of Panadol, paracetamol there. Now, I'm not giving you any idea, folks out there, so don't do this. Yeah, I'm just warning you against taking excessive amounts of paracetamol there. All right, if you must take maximum 8 a day, that's it, no more. All right, don't take for long term as well if possible. Okay, it's bad for your liver. All right, if you need to take often here and there, better do something about avoiding liver damage there, all right? Taking a supplement, for example. Now, the next class of drugs is NSAIDs, non-steroidal anti-inflammatory drugs there. This is commonly used in this class of drugs, right? It's like your ibuprofen, your aspirin, your diclofenac, you know, or brand name naproxen, yeah? All right, that's okay. And there's COX-2 inhibitors, right? Like your Coxia, your Celebrex. All these have been used as anti-inflammatories by the doctors there. Now, the common side effect is that it can cause gastrointestinal side effects like gastritis, inflammation of the lining of the stomach there, or it can even cause ulceration, right? This can cause bleeding, especially for those who are on long-term aspirin for cardiovascular disease there. Okay, I myself have seen quite a few patients with such a side effect there. So if any of you out there who's on aspirin today, because you need to thin the blood, okay, right? You got to check your stools regularly. If at any time your stools is black in color, bad news. Okay, you got to go straight to the emergency because black signifies that you have got bleeding in the upper GI tract. When there's bleeding in the upper GI tract, the blood, okay, is well changed to blackish color there, right? Because the stools become black and sticky. All right, so please go straight to the A&E department there. Okay. Now, the next side effect is kidney, can cause kidney damage. That's right. In fact, I've got a neighbor here who used to have bad gout and he uses quite a lot of painkillers, the anti-inflammatories in the past. And unfortunately, he developed kidney failure in his later years there, right? He's on kidney dialysis now there. So be very careful, all right? Don't use the NSAIDs frequently, all right? It can cause cardiovascular side effects. Heart muscle damage, can cause heart attacks, strokes there, okay? All right, certain these NSAIDs are linked to this cardiovascular side effects there, okay? The Reye syndrome basically affects people who are below 20 years old. It can cause liver damage and cerebral damage as well too there, all right? So avoid aspirin for people below 20 years old there, okay? So of course, opioids, okay, usually reserved for the more severe pain, people on cancer drugs and all that, okay. Who on cancer, we need to have strong painkillers. So unfortunately, these opioids class can have all these neurological, respiratory, and gastrointestinal side effects as well too there. So bear that in mind there, okay. All right, so for those of you out there who need to take something to reduce inflammation, I like to suggest some supplements which can be potentially of help there, all right? Instead of just taking all these anti-inflammatory drugs all the time, okay? So some of the supplements which I find helpful personally is curcumin, all right? Pycnogenol again, then the bromelain, okay? Then the omega-3 fish oil, yes, that's right, folks. Omega-3 fish oil has got anti-inflammatory effects. And then your vitamin D, all right? Vitamin D is known to have anti-inflammatory effects. If you're deficient in vitamin D, all right, your body tends to have high amount of inflammation there, all right? Your immune system tends to go down the hyper-inflammatory pathway there, all right? So make sure your vitamin D level is not in a deficient range there, all right? And for those of you who experience side effects, gastric side effects from taking all these painkillers, right, can take aloe vera. So curcumin, all right, curcumin is actually the active ingredient that comes from turmeric, the curry powder, right? All right, curcumin is known to be a powerful antioxidant. It's got strong anti-inflammatory side effects. It's able to reduce inflammatory markers, all right? And it's been shown to be beneficial to patients with osteoarthritis and rheumatoid arthritis, all right? It's got numerous other benefits as well. It's been shown to have anti-cancer side effects, improve cognitive health, lower blood sugar level, and insulin resistance as well. All right, so this is just a study that compares people on curcumin and this anti-inflammatory drug called diclofenac. Well, guess what? The group that was taking curcumin, okay, shows there's got higher improvement. Sorry, I must qualify first that this is studies which compares these two ingredients, curcumin and diclofenac, for the group of people with rheumatoid arthritis. Yeah, all right. So what they found is that the curcumin group, all right, those rheumatoid arthritis sufferers which were taking curcumin, shows a highest percentage in improvement in the overall disease active scores and the ACR scores there. All right, it's also significantly better than the group taking diclofenac, right? And then more importantly, this group taking this curcumin does not show any adverse events there. The curcumin is safe, in other words, there. Okay, so it's a no-brainer, isn't it? I would rather take something that is safe without adverse effects and equally effective as well. So curcumin can promote normal cell cycle. Curcumin can promote liver detoxification. All right. So you're on drugs, you take alcohol, or you're subjected to other toxins. Make sure, all right, you can take something which helps to improve your liver detox. Curcumin can also improve healthy levels of glutathione. Glutathione is found in every cell in your body. It's a master antioxidant found in every cell there. We want this to be high there, right? And curcumin can improve the glutathione level. So curcumin, unfortunately, has been shown to have poor bioavailability there, all right? You take curcumin, right? Not much of it is absorbed at all, there, less than 5% there, all right? You take a lot of it, you just get a bad tummy upset. Well, guess what? This particular form of curcumin, the curcugreen, can deliver more bioactive curcumin there, all right? It can greatly enhance the absorption and bioavailability of curcumin. So that is why I tend to use this curcugreen there, all right? For my patients there, all right? To people with joint issues especially, okay? And this curcugreen is found in the curcumin extreme product there, okay? All right, yeah, this one there. All right, so I talk about pycnogenol. So pycnogenol, as I mentioned, is a natural plant extract from maritime pine trees. And what's so great about pycnogenol is that it can inhibit the inflammatory pathways here. Here we go. This is the one. It inhibits the COX-2 and the 5-LOX gene expression, inhibiting the COX-2 and 5-LOX inflammatory pathways in our body. So pycnogenol has been shown to reduce inflammation significantly there, okay? Various studies have shown that. It's been proven in clinical trials to improve osteoarthritis. It's been shown to reduce this NF-κB, all right? This is the mediator which switch on your pro-inflammatory pathway. So it reduces quite significantly. It also reduces the inflammatory pathway, the COX and the inflammatory pathway. It reduces cartilage degeneration enzymes there, all right, by more than 25%. It reduces CRP, the inflammatory marker, by more than 70%. That's huge. It reduces oxidative stress in your body by 30%. That's huge, isn't it there? Right? So after 3 months of taking pycnogenol, right, all these sufferers improve have their pain level reduced, stiffness reduced, joint function improved there, okay? So beta-arginine also helps to stimulate collagen and hyaluronic synthesis, helps to rebuild the cartilage in the joints there. That's very important. So bromelain, I talked about it just now there, right? So bromelain is isotonic capable, right? Contains a combination of bromelain, white widow bark extract, and protease as well. It helps reduce inflammation and swelling there, all right? It helps the body natural healing process as well. I mentioned about aloe vera. Aloe vera helps the gut health too, all right? Aloe vera has been shown to have natural healing properties, help to fight free radicals even, helps to promote healthy epithelial growth. That's important for our stomach and our intestine, isn't it there, all right? Okay, helps improve digestion, helps to buffer the acidity of GI tract as well. And I trawled through internet, right? And I found that the studies have shown that it can help to heal lining of the GI tract, balance the pH of GI tract, helps to reduce inflammation, helps in digestion, helps to improve bowel regularity, inhibit the growth of bad bacteria and fungus as well, promotes normal growth of good bacteria, right? And shown to be of some help for patients with all these gastrointestinal conditions there. All right, and I like to use this for my patient, the Ultimate Aloe there. All right, so Ultimate Aloe is derived from whole leaf, all right, and therefore retains the qualities of natural occurring aloe, right? The anthraquinones, the latex component of the whole leaf, significantly removed, all right? In fact, the amount that's left is really, really insignificant there, all right? So be very careful when you take aloe because we want the latex component, which contains the anthraquinones, to be removed there, right? And this particular product has it removed there, right? There's no natural, no artificial colors or flavors, right? And this is not preservative free. And more importantly, it carries this IASC seal, which stands for International Aloe Science Council. All right, this is a prestigious seal which is carried by very few aloe products there, because this seal certifies the purity and quality of the aloe content. All right, so you want to take aloe vera, make sure it carries this seal there. All right, this is the mark of confirmation of the quality and purity of the aloe product there. Okay? So you can take it in juice form as it is here, or in the powder form in the easy to carry packaging there. All right. So let's talk about stomach acid blockers there. All right, it helps to reduce stomach acid production. We use it for patients with GERD, all right, reflux disease, those heartburn, using gastritis. All right, use it for people with ulcers, bleeding, or very often we use it in combination with people on NSAIDs there. All right. So some of the examples of acid blockers will be famotidine, omeprazole, so on and so forth there. So what are the potential side effects? Bone, all right? There's increased risk of fractures, okay, of the hip, or the spine, or the wrist. Why? Because these acid blockers can reduce the absorption of calcium from the gut, all right? It can reduce the magnesium absorption as well, all right? When you reduce the magnesium, all right, this can potentially cause muscle tightness, even spasm, tremors, all right, abnormal heart rhythms, all right. It can increase the tension in smooth muscles in the blood vessels and therefore raise blood pressure. It can cause anxiety issues and even insomnia as well, okay? Or even just simply make you feel tired, lethargic. It can also cause vitamin B12 deficiency. This is because we need stomach acid to cleave, to remove the B12 from the food that we eat there. Stomach acid is important for this purpose. So if you are B12 deficient, it can cause reduction in red blood cell formation there, all right? Resulting in anemia, can cause what you call cognitive problems as well too, resulting in memory issues there, okay? Resulting in poor balance, generalized weakness as well. Stomach acid blockers can cause an increased risk of gastrointestinal infection. This is because the stomach acid is important to kill the pathogens in the food that you eat. That is why people on stomach acid blockers are increased risk of food poisoning, right? So be very careful there. So you're on this blockers, okay, you are increased risk of digestive issues as well, because the stomach acid is important for digestion of food. All right. Stomach acid is important to break down the food that you eat, besides digestive enzymes. Okay. All right. It helps break down the food that you eat into smaller nutrient building blocks so that our body can absorb these vitamins, nutrients, or other nutrients there. So what can you do to ameliorate the side effects of stomach acid blockers? Well, you can take digestive enzymes, all right? Digestive enzymes to digest the food. You can take multivitamins and minerals, okay, to help to prevent deficiencies there, all right? So one of the things I like to use is this isotonic digestive enzymes with probiotics there. Okay, it contains digestive enzymes and probiotics, helps to promote digestion of food and hence the absorption of the digested food there. It also populates the gut with good bacteria, all right, to promote gut health, right? So it contains this isotonic capable food supplement called Digizyme, all right? It's a complete brand of enzymes that we need, that the amylase, the protease, the cellulase, the lactase, the sucrase, and lipase there, all right? Okay, all the complete range of enzymes that we need to digest the foods, okay? And it contains this particular probiotic called Bacillus coagulans, which produce spores, okay, which will then go into our small intestine, large intestine to germinate into good bacteria there, right? So this Digizyme is a full spectrum enzyme blend. It's acid stable, so therefore able to work in a wide range of pH environment. Unlike the other enzymes, it's vegetarian, gluten-free as well, GMO-free too. Okay. All right, the next thing I want to talk about is corticosteroids. Okay, some of you would have used it some time or another. What is it used for? For autoimmune diseases there. All right, for example, people with lupus, systemic lupus erythematosus, people with rheumatoid arthritis, or those with inflammatory conditions like rheumatoid, your asthma, eczema, even people with allergies as well. Okay, so corticosteroids come in different forms. Can be inhaled form, all right? So we use this typically for asthma sufferers or those with chronic obstructive airway diseases. By and large, these inhaled steroids have got very little or no side effects at the normal dosage there, right? If they do, they can be localized, like can cause sore throat, oral thrush, hoarse voice, cough, or even nosebleed, all right? Now, injection form can cause a bit more side effects. It can cause, well, the muscle or tendon to weaken and even rupture as well. The skin to thin, loss of color, even cause infection, can raise the blood sugar level as well. Yes, steroids, corticosteroids can raise blood sugar level. The topical steroids, if you apply for long periods of time, can cause skin effects like these, all right? All right, the oral steroids, got to be careful there, right? If you take long term, can cause skin side effects like these, right? Can cause weight gain with fatty deposits in the face, the abdomen, and the back of the neck there, all right? Can cause muscle weakness, can cause fluid retention, causing leg swelling there. Can cause eye problems like glaucoma, cataracts. It can raise your blood pressure as well. Okay, all right? It can cause your blood sugar level to go up, increasing the risk of diabetes or worsening your diabetes. It can cause osteoporosis and fractures as well. All right? It can cause neurological problems. Okay? It can cause gastrointestinal problems like stomach ulcers. Increase the risk of infections. This is because corticosteroids suppress your immune system, right? Therefore, you increase risk of fungal infection or shingles, for example, there. All right? It can suppress your adrenal gland hormone production there. It can retard growth of children. Right? All right, so if you have got to use something to reduce inflammation, these are some of my suggestions there, right? So I mentioned earlier already there, right? Curcumin, pycnogenol, omega-3 fish oil, bromelain, vitamin D, right? On top of that, all these supplements have got other health benefits, all right? And like I said, curcumin and pycnogenols are powerful antioxidants, for example, all right? And guess what? All these I just mentioned above, all right, are immune modulators. They are able to moderate our immune system, all right, reducing our immune system, preventing it from going on a hyper-inflammatory drive there, all right? So that's what's so unique about these these supplements there. All right, they not only can provide benefits for different medical conditions, but they have other benefits for our body as well there, and minimize side effects too. Right. Antibiotics. Well, most of us will have used it from some time or another, isn't it? Well, antibiotics, unfortunately, are not smart bombs. They kill good bacteria as well, not only the bad bacteria, right? Unfortunately, one of the bad bacteria that can proliferate after the use of antibiotics will be this Clostridium difficile there, all right? And when this happens, right, this can cause mild diarrhea to potentially life-threatening infections there, all right? So this infection can come on even during the course of antibiotics there, all right? Then antibiotic resistance, that's not what we want, isn't it? Yeah? Antibiotics, widespread use of antibiotics have promoted widespread antibiotic resistance there. So candidiasis, fungal infection, all right? This can happen in the mouth, your skin, your genitals. In this particular class of antibiotics called quinolones can cause muscle tendon inflammation and causing rupture there, okay? Oops, sorry. So if you have got to use antibiotics, I would highly recommend that you start using probiotics there, all right? And so probiotics can provide you the beneficial bacteria. It also helps to support healthy digestion and good gut health there. And unlike this particular brand, right, I use this for my patient, right? It's called Probiotics 10, right? It gives you the 10 different strains of probiotics. It also gives you 10 billion CFUs per serving, the colonies forming units. All right, it contains this two technology, the LifeBac and the LifeTrack. The LifeBac enables the bacteria to survive the bottling process and under normal storage conditions as well. All right, without refrigeration. The BioTrack technology enables the good bacteria to survive the stomach acidic environment, to go down to the gut to exert its beneficial effect there, right? So we want all the bacteria that we take, the good bacteria that we take, all right, to be able to go down to the gut there and not simply leave it to chance there, will it survive the stomach acid or not? So even you tell me that you take 100 billion CFUs per serving, all right, from another product. My question to you is this: can this 100 billion, how many of this 100 billion CFU actually survive the stomach acid, all right, to go down to the gut to give you the benefits there? Huh? Right? You're not sure. On the other hand, this particular product uses this two technology to ensure that 10 billion goes down to the gut to exert its beneficial effect. We don't need a lot of this, really. All right, we just need about 10 billion. That's good enough there. And like I said, it contains 10 carefully selected bacterial strains as well, 6 lactobacilli strains and 4 bifidobacterial strains there. Okay, so that's what makes this product unique there. So estrogen therapy. All right. Number of you could be on this right now. We use it for menopausal symptoms, PMS, the premenstrual syndrome. Yeah, right. We use it for contraception. You use it to replace estrogen deficiency. All right. So what are other potential side effects? Well, increase the risk of deep vein thrombosis and thromboembolism. Well, thromboembolism basically means that the blood clot that's formed, right, elsewhere in your body travels to another organ there, for example, the lungs there, right, and cause problems, right, can potentially increase the risk of cancer of uterus and breast. There's a slight increase here there, all right, and also increase the risk of heart attacks there. Okay, so you've got to be really careful there, all right, increase the risk of vaginal bleeding, increase risk of strokes as well. So one particular product I like to use instead of using estrogen is this Prime Feminine there, okay? Because this can help to stabilize mood, all right? Reduce the discomfort associated with menopause and counter the mild effects of PMS there, right? It's able to do so because it contains natural herbs, all right? And also soil as well there. And these are the natural ingredients there, all right? It contains also B vitamins as well, and all these, dongquai, soy isoflavonoids, wild yam, black cohosh, so on and so forth, right down to all this Tribulus terrestris there. Okay, so all these are natural stuff, right? And the benefits of these ingredients are as shown, okay? Ranging from relieving menstrual cramp, hot flushes, all right, is able to elevate all these menopausal symptoms. Even helps to relieve the PMS as well too. There, right? Promotes normal levels of female hormones as well. So these are the various effects of these natural ingredients there. So I like to use this there, all right? And I find it very effective, especially for PMS. All right, I've got one particular patient I remember very well who's still using this. All right, she's got severe PMS syndrome, but the moment she started using this, right, her PMS got so much better. And on top of that, I recommend magnesium as well, isotonics magnesium. This improved her pain even more there, all right? She got pretty bad menstrual cramps there. Yeah, so together with Prime Feminine and isotonics magnesium, menstrual cramps actually improve significantly without having to use those drugs there. Okay, so these are more benefits of these natural ingredients. Okay, so you took a snapshot already. All right, so drugs can also cause nutritional deficiencies there. All right, so what are some of the common drug-induced nutritional deficiencies? Magnesium is the most common. All right, you can see the list of drugs that can cause magnesium deficiency are pretty long. Okay, ranging from acid blockers to antibiotics and blood pressure medications, and a whole long list here there, right? Okay, even alcohol and caffeine, by the way, don't take too much, folks, all right? Because alcohol and caffeine can inhibit the absorption of nutrients, and it can also have got diuretic effects, increasing the excretion of water-soluble nutrients, like your water-soluble vitamins and minerals, right? The next on the list is coenzyme Q10. Again, a whole long list, all right? So be very careful. Then also followed by folic acid, B12, B6, okay? And your glutathione as well too. So really there are more, but I'm just listing the top few there, all right? And the top on the list, the top three of these there, all right? So folks, be very mindful there. So isotonics magnesium, I just talked about, all right? Great for relieving PMS there, all right? Okay, I like this magnesium very much there, all right? So what makes it unique? It uses the highly bioavailable forms of magnesium, the citrate and the glycinate forms there. These are readily absorbed by our gut into our body, all right? On top of that, it's isotonic capable, further maximizing absorption and bioavailability. It's got a fast onset of action, all right? How fast? You can fast onset of action as fast as within the first few minutes. I myself experienced the benefit. What happens is that, I had on several occasions severe cramps on my calf leg, in the middle of the night while sleeping. Well, the cramps didn't go away for several minutes, and I finally decided enough is enough. I hobbled to the kitchen, made myself two servings of magnesium. I drank it, and within about 2 to 3 minutes, my cramps went away. It didn't happen once, but 3 times, I remember at least that, right? So that's when I realized I was low in magnesium, okay? Oh, man, so not good. So I've experienced personally how effective this isotonics magnesium is. So it's easy to consume in solution form. It's got a nice taste to it as well too, all right? So those of you out there, if you've got magnesium deficiency symptoms, which I talked about earlier, please use a highly bioavailable forms of magnesium, okay? Now, of course, we have other highly bioavailable forms of vitamins and minerals, like the isotonics multivite without iron, the isotonics calcium plus, and then the isotonics advanced B complex there. And coming to the market, Singapore, there's the there's the isotonics activated B complex. It's coming soon. And well, I like this very much because the B vitamins, in particular vitamins B6, 12, and folic, is already in the activated form there. Our body does not need to convert these particular vitamins to the active forms. Yeah? So the onset of action is even faster. All right. Okay, so I've talked quite a lot, so coming close to the end. So before you start the drug, especially for long term, all right? Now, I keep emphasizing for long term. This is because, well, the longer you take a a drug, a medication, the higher the risk of side effects. All right, this is well proven. All right, so before you take a drug, especially for the long term, right, consider these factors. Are there other better and safer alternatives like lifestyle changes, nutritional supplements, right? Especially if you're, say, diabetic, you're overweight, yeah, right? So what are the possible side effects? Think about it, all right? Well, do your own homework there, all right? And of course, first and foremost, do you really need a drug? What are the indications there? Are there strong indications for it? All right, weigh the pros and the cons there, right? Okay, the benefits outweigh the potential risks there. Weighing the pros and cons, right? How long has the drug been on the market? All right, because this got a bearing on the drug safety profile. The longer the drug is in the market, the better we know the safety profile there, okay? I quote you two examples. For example, the Vioxx there is a COX-2 inhibitor. It's an anti-inflammatory drugs we use to treat rheumatoid arthritis patients in the past. This drug was approved by FDA in 1999. Unfortunately, it had to be withdrawn 5 years later in 2004 because we found that this drug Vioxx is associated with increased significant risk of heart attacks and strokes in patients taking this drug for more than 18 months there. So as a result of this drug was withdrawn from the market. Another drug, Lipobay, which is used to treat high cholesterol, all right? This drug had to be withdrawn after about three to five years, I can't remember, yeah? All right, because it was found to increase the risk of rhabdomyolysis, all right? Increases the breakdown of muscles. And this drug was associated with the death of more than 50 patients from rhabdomyolysis, all right? So, all right, so if you have got to take the drug, how do you monitor your condition and the side effects of the drug? What to look out for, okay? Do your research, ask the doctor, check, okay? Check online even if you have to there, all right? So is there anything that you can do to, or take to reduce the side effects, the risk of the side effects there, okay? So to reduce and to prevent drug side effects, I just give you some examples, okay, of nutritional supplements you can take. For example, liver, all right, you want to have a liver to detox if you are taking certain drugs. Well, you can consider supplements like curcumin extreme, the oxygen extreme. Now, I did mention oxygen extreme earlier. Well, this particular product contains milk thistle, and milk thistle is known to help liver detox there. It can even help to regenerate your liver cells, okay? Right, you can consider taking antioxidants there. Why antioxidants? Because free radicals are produced during drug metabolism. So antioxidants can help to counter these free radicals, right? They can also help to boost our immune defense system, and they have got anti-inflammatory effects as well, right? So things like OPC3, astaxanthin, vitamin C, curcumin, right? Coenzyme Q10, if you're taking statins, that's important because statins deplete your coenzyme Q10. Right? If you're on antibiotics, take probiotics there because it helps replenish good gut bacteria. And my suggestion is take it while you are on antibiotics. Don't wait till the end of the course of antibiotics, because by the time you wait till the end of the course of antibiotics to take the probiotics, all right, your level of good bacteria can be severely depleted to the point where you already allow the bad bacteria to grow, right? Like the Clostridium difficile, the fungal infection there, all right? On the other hand, you take it during the course of antibiotics, yes, you can, the antibiotics may kill the probiotics, but it prevents, the level of good bacteria from going in a straight line down all the way. Yes, it goes up and down when you take the probiotics, but don't take at the same time as the probiotics, as the antibiotics, that's all, if you're taking probiotics, yeah? All right, take at different times, okay? Several hours apart if you can, okay? It prevents complete depletion of the good bacteria in the gut, the probiotics there. Now, aloe vera, if you're on NSAIDs, helps to protect and heal the gut lining. Digestive enzymes, if you need to take stomach acid blockers, all right, it helps to prevent, to reduce indigestion, malabsorption of nutrients. All right, unfortunately, this is very common, really. All right, this use of stomach acid blockers, okay, causing indigestion. In fact, what doctors do is if you find that you've got increased GERD, okay, gastric reflux, they use stronger stomach acid blockers. Unfortunately, the stronger stomach acid blockers further aggravate the indigestion there, all right? So, and malabsorption of nutrients. So guys got to be very careful with this there, all right? You should not be on prolonged stomach acid blockers, all right, without very, very good reasons, right? So I mentioned earlier, drugs can deplete these micronutrients, okay? So you can consider supplementing your vitamins and minerals as well. All right, so those of you who have been asleep, now it's time to wake up. The summary. All right, just want to give you a few parting shots. So all prescription drugs can cause side effects there. All right, so use them judiciously. All right, so if you need to use these drugs, monitor your condition, and for side effects as well, consider non-pharmacological alternatives where possible. Example, health supplements, lifestyle changes to help your medical condition and to ameliorate the side effects of the medications there. Okay, so remember, the medication that you take may be beneficial for your medical problem, but it can be potentially toxic to your body. All right. Well, with that, I end my talk there, ladies and gentlemen. So I hope it's been a fruitful session for you there. Okay. All right. I think that's what I have for now. Felicia?
Yeah, thank you so much, Dr. Neil, for the fantastic sharing. And I think this is really beneficial for every one of us to understand, basically taking medication in the long run, there's actually certain side effect that you're getting. Okay, I can see that there are some Q&A that people have posted in the Q&A box. So maybe we'll take some time from Dr. Neil to just go through some of these questions for the benefit of everyone here. All right, Let me just check the Q&A. All right. Okay. First of all, okay, there's many questions, so we just randomly pick some to answer because of the time factor. Okay, first question here. Does consumed omega fish oil help blood vessel blockage more than 60%?
I'm not going to go into very specifics like this, but in general, omega-3 fish oil does help to increase blood circulation. But as to whether it really helps blockage, I don't think I've seen studies, but it can indirectly help because it helps to reduce your triglyceride level. It can help to reduce, to some extent, your LDL as well too. Yeah, so it helps indirectly to me there. All right, it's good for your cardiovascular health anyway. But if you got this amount of blockage already, I'm not going to say please just take this only. No, all right, don't quote me on this. I already said that. These supplements are not meant to replace the medication that you may be on. So don't get me wrong on this there, all right? So you should ask your treating doctor. But overall, what I'm prepared to say is omega-3 fish oil is great for cardiovascular health for the various reasons I just mentioned in my talk there, all right? Okay.
Okay, all right. And how about omega and liptotrin? Omega and liptotrin, do we have to take them together, or we can just take one of them? How do we?
You can take both together. In fact, for added benefits there. All right. You can take for added benefits. Yeah. All right.
All right. And what tests can we do to measure the LDL small particles and the LDL elevation?
Oxidation.
So that basically this is not the usual LDL figure. So we get from standard lipid test, correct?
Yeah, that's right. These are not from standard lipid tests. Well, guess what? Your doctor can actually do such detailed testing. All right, the small LDL particles. Yes, right. So there's a certain detailed test which can be done, but not done by all labs, unfortunately, as I understand. Right, not many labs do this kind of test. So you got to ask your doctor about this for this particular test. Yeah, but what I've learned is that the LDL level from the normal lipid testing does not give you the real picture. All right, the LDL level includes the small dense LDL particles and the big fluffy LDL. All right, so the big fluffy LDL are not the problem. All right, it's not a problem. It's the small dense LDL particles there. All right, and also the oxidized LDL particles in particular. Yeah. All right. So we need to have fewer amounts of small dense LDL particles and also prevent them from being oxidized as well too. All right.
Okay. Next question. So my mom took the astaxanthin and her eyes became swollen. Is there a reason?
I really don't know. Could she be taking something else on top of astaxanthin? You know, could she be sensitive to something in the astaxanthin product? So I don't know which astaxanthin product you're talking about though. All right. Sometimes could be other ingredient inside. So this is very specific. I cannot answer you like that. Yeah. So we've got to consider other possibilities there. All right. Yeah. Okay. Because she could be taking astaxanthin at the same time taking something else, medication or some other food which caused this eye swelling. I really don't know. These are the various possibilities that go through my mind.
And Dr. Neo, is there any difference, by the way, for the prime and the isotonic astaxanthin?
The isotonic astaxanthin comes in isotonic form, so they've got very high absorption and bioavailability rate. All right. On the other hand, the prime astaxanthin is not in isotonic form. It comes in a gel capsule. The gel capsule, unfortunately, is made from bovine source, so it's not vegan. All right. On the other hand, the isotonics astaxanthin is vegan. There's no animal product at all there.
Okay. Okay. And the both OPC and astaxanthin have very high antioxidant. So which should be the one we should be taking or more suitable for us?
Astaxanthin, OPC and okay. Astaxanthin and OPC. Okay, it's your next question. Oh, okay. All right. Well, no harm taking both. Honestly, both OPC and astaxanthin provides a bit different. Okay, in terms of benefits. There, astaxanthin is able to provide protection to the both water soluble and the fat soluble layers of our cell membrane. Okay. On the other hand, OPC provides protection to the water-soluble parts of a cell there. All right. So, I would say if we combine the two together, the antioxidant benefits are really enhanced. Okay. So, and we know that the astaxanthin also have got other benefits, for example, visual health, muscle health, what else there? Yeah, I talk about anti-aging effects as well too there. Okay, so then OPC, which contains pycnogenol, has been shown to have immense cardiovascular benefits, even slowing down the rate of atherosclerosis as well too. So I would say there are different supplements with slightly different benefits. All right. So to me, no harm taking both. All right.
Okay.
Yeah, really, I would say your antioxidant protection is greatly enhanced there. Okay.
Okay. And Dr. Neo, can early stage of pregnancy take OPC3?
All right. Now, I've checked through this one here. Ideally, when you're in the first trimester of pregnancy, we should try to minimize taking of medication or even certain supplements as well. Now, there is no studies which shows that OPC3 or pycnogenol, in particular, is harmful to the pregnant women there. All right, there's no known studies. Okay, all right. Studies have shown there's no major side effects for pregnant women as well. But out of abundance of caution, I've seen a website from US, I think on advice of use of herbal supplements for pregnant women. They say that it's advisable not to use things like pycnogenol, right, in the first trimester. It's just out of abundance of caution. That's all there. All right. So my belief is also this: if you're in the first trimester of pregnancy, well, try not to use unnecessary things. All right, drugs or certain supplements. Okay, which So if you want to take OPC3, you can take from the second or third trimester onwards there. All right. So that's just our abundance of caution. Yeah. Right.
Okay.
So not to say that you cannot take, but avoid if possible. That's all. Okay.
Okay, so for people who are suffering side effect from statin, the muscle memory and loss and things like that, so what can we do to reverse these changes to the muscle, brain, etc.?
Really, you got to ask yourself, or even a doctor, do you really need to take statins in the first place there? All right, that's what I'm trying to drive at. Okay, unfortunately, too many patients have been put on statins unnecessarily. The moment the doctor sees, oh, your total cholesterol is high, or LDL is a bit high, put you on statins straight away. Now, that is not the correct thing to do now. All right, but unfortunately, it's still being done. We need to individualize the risk. All right, see the risk profile of each patient there. All right, if you're if you're just found on routine screening, yet your total cholesterol is high, your LDL is high, all right, you should not be started on statins straight away. All right, the first line is always lifestyle changes. And like I said, the total cholesterol and the LDL levels really does not give us very useful information. The total cholesterol includes your LDL and your HDL and the other cholesterol as well. The LDL levels includes the big fluffy LDL and the small dense LDL particles.
Okay.
Right. So you could have a raised LDL because of a raised level of big fluffy LDL, which is not associated with cardiovascular disease. All right. So it's not really useful to looking at LDL levels there. All right. So if I were a doctor, I would go one step further to check the small, dense LDL particles if possible. All right. And then if really got to lower cholesterol level, then lifestyle changes is much more important. All right. Start eating right. Eat the right kinds of food. Avoid those inflammatory foods there. All right. If you're overweight, all right, you lose weight. But I can tell you, if you eat right most of the time, you will lose weight automatically without even trying there, okay? And you can take supplements as well, all right? You can take supplements, like I mentioned, to help, you can help to improve your metabolic profile, your cholesterol level, or improve your HDL. Right? You can take coenzyme Q10 if you need to be on statins there, all right? Etc. So I recovered that already.
Okay, so I love Turn Up supplement, and I know that there are people around me who benefited from the energy boost from the Turn Up, but I do see that some people with high blood pressure, they actually couldn't take it. So I wanted to know why people with high blood pressure can't take Turn Up, and also what would you recommend to boost energy as alternative to Turn Up for people with high blood pressure?
Okay, it's not to say that people with high blood pressure absolutely cannot take Turn Up. You got to monitor. That's all there, all right? Turn Up does not contain caffeine, but it contains other forms of xanthines, okay? Xanthines can potentially only raise the blood pressure, but not as much as caffeine, all right? So if for those people with high blood pressure, if they really need to take something to perk them up, well, if you want to try Turn Up, you can try, but just monitor your blood pressure. All right. Now, an alternative to Turn Up will be taking our B vitamins there. All right. So B vitamins I find really helps to perk a person up, especially the activated B vitamins. Sorry, I keep talking about activated B vitamins because I'm taking that from myself right now. That it comes from the United States, but it's coming to Singapore. Yeah. All right. So the moment I take the activated B vitamins, I perked up within the hour. I never had to use caffeine or whatever there. All right. So so that's an alternative. Yeah, the B vitamins there. All right. So but by and large, I don't see that as a real problem for people with high blood pressure. But then again, different people respond differently. Got to monitor. So if they take Turn Up and their blood pressure goes up, then opium. Yeah. Don't take that. Okay, yeah, that's right. So the other thing for people who feels tired all the time, they could be lacking in other nutrients like magnesium. So magnesium can unfortunately be severely depleted in such individuals. So if you are deficient in magnesium, you can actually feel tired, lethargic, because magnesium is important for ATP production. If I remember correctly, it's important for what, 6 out of what, 8 steps in the production of ATP. ATP is the energy that our cell needs there, right? So if you're lacking magnesium, you can also feel tired, lethargic as well. So, right, so it could be a deficiency of magnesium, B vitamins, etc. there, right? That's causing him to be lethargic. Huh?
Okay. So, Dr. Neo, can person who are still on cancer medication take anti-inflammatory supplement like Pneumonia?
Oh, okay. Yeah, if they're on medication, okay. Right. If the medication they're taking does not cause does not have a free radical oxidation effect on the cancer cells, then I'll say yes, you can take supplements like pycnogenol or other antioxidants. All right. So check with your doctor on the type of cancer medication you're taking. If the cancer medication basically works by causing killing the cancer cells through oxidation, all right, then you should avoid for the time being. All right. Radiotherapy is one. Okay, they use cause oxidation of the cancer cells, so you should avoid taking antioxidants while you're on radiotherapy. Yeah. Okay.
I see. Okay. And we have a friend who are low in iron, and that's thinking of introducing the Women's Health to her. Or actually, what do you think? Will multivites with iron from Global be a better option for someone who is low on iron?
Now, the multivites with iron contains some iron, but it does not have high enough level of iron to replace the iron deficiency in such patients there. All right. So if, let's say, that this particular friend of yours has got a very low level of blood count and very low level of iron, all right, taking the multivites with iron will not be enough. The amount of iron is not high enough. That's what I'm trying to say here. So she got to take additional iron supplements on top of that. But the multivites like vitamin C can help to promote the absorption of the iron that she takes there.
Okay. And how long can a person take Prominent for anti-inflammation purpose?
Well, I will suggest for the acute, when they have the acute condition and when the acute condition resolve. All right. I don't recommend it to take for long term, for a long time, because the bromelain plus contains this white widow bark extract, which contains aspirin-like compounds, the salicylates. All right. So as you're aware, aspirin can potentially have side effects. So these aspirin-like compounds, salicylates, may potentially have the same side effects as aspirin there. All right. So for that reason, I don't recommend taking it for long periods of time. So only for the acute, or until your acute condition resolves there. All right. Okay.
Okay. I've got 2 questions from 2 different persons here regarding the same issue. Okay. So one of them is asking, what can we use to increase platelet count?
Well, platelet count. Well, okay. Offhand, I would suggest. Let me see. Offhand, I'm not sure of any specific supplement, but definitely you need to increase your basic nutrients, like your vitamins and minerals there. All right. And also, again, depends on what's causing your low platelet count, really. All right. So it's not the good question. Not a question I can answer satisfactorily, I'm afraid. Yeah. So
actually, there's another person who's asking the reverse. They're asking whether why and what is the cause of someone with high platelet count, and whether is there anything that we can recommend to someone who has the high platelet count.
Well, unfortunately, none of the products here really are meant to lower platelet levels there per se. Yeah, there are various reasons why a person can have high platelet counts. Yeah, the bone marrow is overactive, they produce that particular cell line platelets. You know, so yeah, it's a kind of myeloproliferative disorder. Yeah, so unfortunately, supplements, as far as I know, don't work for this kind of conditions. Okay.
Okay.
Yeah.
Okay. Actually, we have so many questions, but due to time, I'm going to take one more question, Dr. Neo. All right. So, is it advisable to migrate gradually from statin to related medication like to CoQ10, isotonic, OPC, etc.? So, with the aim to eventually cut off the statin medication. So, if yes, what would be the time frame? Like how to gradually migrate from this to the supplements?
Again, I must reiterate, the purpose of my talk is not to say that these supplements can replace the medication you're taking. All right, don't get me wrong. Okay, I mean, emphasize that again. I never advocated that. So you should discuss with your treating doctor. But if you're on statins, you can take all these supplements at the same time as well. But if you find that hey, if you find that you don't really need statins, okay, if you don't really need statins, okay, all right, and you've discussed the issue with your treating doctor, all right, then my suggestion is, well, you can gradually tailor it off yourself there, all right. There's no hard and fast rule. All right. It's not that the moment you stop statin, you will drop dead or heart attack or something like that. No. All right. So you can tailor it off. Also, some people I know, if they truly want to stop the statins after discussion with their doctor, they just simply stop without even tailoring it off there.
Yeah.
Right?
Yeah.
So no hard and fast rule. But again, I must emphasize, okay. Through this talk, I'm not trying to tell you to replace your medication with these supplements. No. All right. I must reiterate that again. Okay. Please do your homework. Discuss with your doctor first. Okay.
Yes, thank you, Dr. Neil, so much for your time. And I think, like what Dr. Neil said, it is true. We got to adjust, monitor, and along the way, you know your body best, and everybody's bodies are different. So you got to adjust according to your body reaction as you do any medication or any supplementation. All right. Okay. So before we end off this section, I know that many people are asking, when can we listen to Dr. Neil again? Is there any upcoming talks by him? So I'm going to share screen, all right, to show you the upcoming talks that Dr. Neil is going to be hosting in the month of July, August, and September for the next quarter. Okay, let me just share the flyers so that you can actually take a screenshot and register for the session, because we are on Zoom, so there's actually a limited capacity. So if you are interested or your friends are interested, do register them early. All right, so the next coming up one will be actually in July. All right, July the 9th. So understanding women and men health. All right, so this will be taking place in the evening via Zoom. All right, okay, then the next one that we are going to have is Dr. Neil talking about heart health, and this is also via Zoom. So it's going to be on the in the August, and then basically it's also in the evening. And last but not least, the third one will be the bone and joint health. All right. So this is going to happen in September, also via Zoom. All right. So let's thanks Dr. Neil again for the time, fantastic sharing, and we'll see you again. Bye.
Thank you very much. Take care, folks. All right.